I'm Mark Breitenball, Chief Executive Officer with Hopewell Health Centers, and since its inception, Hopewell Health Centers has worked to realize our vision of a community where everyone has a healthy body, mind, and spirit. Our agency's very name and identity were selected from the recommendations of a client and a staff member who were inspired by the Hopewell people who called these hills home long before we did. As leaders, we strive to follow their example of a peaceful and collaborative spirit. As safety net healthcare providers serving the people of rural Appalachia, it is our privilege to provide high-quality, integrated health care to all members of our community. In this moment in time, especially in this time when people in our nation are standing up to address acts of racism, it is vitally important that we are very clear and present with those who suffer from racial violence and oppression. In our rural region, these acts may be more covert than in our urban counterparts. Some in our region feel that these problems just don't exist here. This is precisely why it is our responsibility to speak out and stand up for what we know is right. We acknowledge that despite our best efforts, there is bias, there is inequality, and yes, there is racism in our healthcare systems and in the communities in which we live and work. We can do better. We must do better. We must seek to understand and to listen to those who are experiencing the impact of biases, inequality, and racism. We must answer the call to elevate the voices of those who are going unheard. We must continually strive to offer the highest quality of integrated healthcare to every member of our community. We must endeavor to become strong examples of the highest standards of social justice within our community healthcare system. We must work to better understand how we, and those we serve, can develop a dialogue that creates a space for everyone, especially our community members who are existing in oppression. We will do better. We will commit ourselves to being part of the catalyst for change in systems and to care for all who come through our doors.